Total hip replacement, instructions for physical therapy. After your hip replacement, it is important to follow the recommendations and postoperative restrictions provided in order to promote a speedy recovery. It is important to ice frequently and keep your activity level low after surgery. You should avoid actively using the muscle on the front of your hip to lift your leg when changing positions or transferring in and out of the car and/or bed. Avoid moving or forcing your hip into any painful positions. For the first 6 weeks after surgery, it is important that you do not stretch your leg too far behind or rotate your leg too far out away from your body. You will be instructed to use a walker for a minimum of 2 weeks or until your first follow-up visit after surgery. You are permitted to have weight through your leg, but the walker is used to allow enough weight to be removed from the leg to prevent increases in pain while you're walking. It is important that when using the walker, your first step is taken with your surgery leg. Your foot should be placed flat on the floor, and you should avoid limping or walking with a toe touch type pattern. Limping on your toe without your foot flat on the ground will irritate the muscles at the front of your hip and lead to increased pain and swelling. You will also need a cane after surgery, which will be used along with a handrail when available to go up and down stairs. During your preoperative physical therapy visit, you will be shown the correct technique for walking with the walker, as well as for going up and down stairs with the cane. It is important to limit the number of times you go up and down steps initially after surgery, as frequent use can increase pain, swelling, and delay your recovery. Your activity level should be kept very low after surgery, and you should rest as much as possible in the first couple weeks following surgery. Strict bed rest is not recommended, but being too active will not speed up your recovery. Too much time on your feet and too much activity can increase inflammation, swelling, and pain. You are encouraged to move around your house with use of your walker. It is not recommended that you walk for exercise in the early phases of your recovery. You should plan to have someone assist you with basic activities around your home, including cooking, cleaning, and laundry for the first 2 to 3 weeks after surgery, as these tasks can easily aggravate your hip. Avoid sitting in an upright position where the hip is flexed to 90 degrees for prolonged periods of time. A more reclined position will prevent increases in pain or soreness at the front of your hip. As previously mentioned, during your preoperative physical therapy visit, you will be shown how to correctly walk and go up and down stairs with a walker or cane. You will also be provided with a basic home exercise program which includes lower level circulation and muscle activation exercises. These exercises are to be completed several times per day, starting the day after you come home from surgery. All exercises should be pain-free, and any that produce pain at the front of your hip should be avoided until they are pain-free. When you return for your 2-week follow-up visit, you will be provided with an updated home exercise program. This program replaces the previously provided program and will include several exercises which are to be done independently at home. At the time of this visit, your ability to transition from the walker to the cane will be assessed. If pain and swelling are well controlled, and you're able to demonstrate correct use, you'll be able to use the cane for all in-home and short out-of-home walking. It is still not recommended to start walking long distances or walking for exercise at this time in your recovery. At the time of your 6-week follow-up visit, you will be provided with an additional home exercise program. These exercises will focus on restoring the flexibility necessary for a normal walking pattern, as well as developing the strength needed to progress towards returning to your desired level of activity. At this time, you will be given the option to continue to independently work through your exercises at home and follow up with physical therapy intermittently to address any remaining impairments or functional limitations. If you would prefer more structured, formal physical therapy with supervised guidance, you will be provided a prescription by your surgeon to start physical therapy at this time.